Thank you very much for inviting me to talk to you today. My name is Greta Mclachlan, and I'm going to talk to you today about women in medicine and women in leadership. Just so that we know where we stand, my talk is about 15 minutes long, and I'm going to therefore hopefully allow for some discussion and some questions at the end. I think we've already had one question come in about the hashtag #MedBikini saga, shall we say, that's happened recently. And just this morning, I was trying to work out whether or not I should put that into my talk, but decided against it. But it's obviously something that I have thoughts on, and I think most people that know about it do as well. So I think we can start with that as a first question once we've gone through and learn a bit about some of the stats. Obviously, if I completely bore you and there aren't any questions at the end, then you'll get an extra sort of 10-15 minutes for a biological break, as a recent colleague of mine called it. So my talk is split into a few parts. The first is me telling you a little bit about who I am and why I'm here. The second part is talking to you about some statistics in relation to gender representation in medicine. The third is about COVID, because few talks, I think, in 2020 could fail to mention COVID. I don't know if you know, but there's been a pandemic going on. And then I'm going to finish about telling you about how you guys can actually get involved, influence, and become leaders. I'm telling you this to try and keep your interest and hopefully so you know what's coming up next. Please feel free to tweet during this talk using the hashtag BHCC2020 and atting me at my Twitter handle, which I will just put into the chat there. So feel free to @ me, add me, DM me, stay in touch. Tell me how well you think the talk's going or how badly. I'm open to all types of constructive criticism. But make sure you use the hashtag BHCC2020. Let's begin, shall we? So I am one of 5 founders of something called Women Speakers in Healthcare. Women Speakers in Healthcare is the world's largest database of women speakers from healthcare backgrounds. Our vision is for a balanced representation at all healthcare conferences and events with parity of opportunity for all. We created Women Speakers in April 2019, following yet another all-male panel at a conference, or as they are affectionately known, MANL, and this was being discussed on Twitter. We felt frustrated and annoyed that so many conferences do not take into consideration the power that speakers have in representing the workforce. And I'm very pleased to say that I cannot see any of these MANLs at today's conference. Well done, Raj and team. You guys are the future. What these conferences then miss is they miss the opportunity for role modeling to the audience what you can aspire to be. And in some cases, it really feels as though there's no thought process behind the appointment of speakers whatsoever, and that there is no understanding that you cannot be what you cannot see. But being the scientists that we are, we didn't want to jump to conclusions or to Twitter rage. So we looked at the literature and evidence to see if we were right about our hypothesis. So amongst others, we found a couple of articles that I'm going to talk about. And if you'd like any of these references, I can share them with you in the chat box later, or you can DM me on Twitter and I can share them with you there. But there are 2 JAMA network articles that I'd like to have a brief discussion about, because they both looked at the proportion of female speakers at events. One looked at 10 years worth of conferences in Canada and America, and the second looked at a few main educational conferences that happened in America over a 10-year period. So both of these are large data sets over a long period of time. The first of these articles has actually got some good news. It shows that there's been an increase in female speakers from 2007 to 2017. An increase from 24.5% in 2007 to 31 to 34.1% in 2017. Yay, we're getting better, you'd think. Unfortunately, this increase is explained by a proportional increase in the number of women attending the conferences. So there are more women attending, therefore there are more speakers of women. The second one simply shows that at these major educational conferences, only 29% of the keynote speakers were women, which isn't good enough. Now, this can arguably have knock-on effects. When women don't present, it can contribute to the fact that there are fewer women publishing articles, because we know that conferences and publications are quite closely linked. Because as of 2014, only 37% of first authorship of articles in the top 6 leading medical journals were women. So again, that's big data. That's just not a small anomaly. And as you know, and we all know, publishing is power. Publish or perish, as the expression goes. Now, publishing leads to academic recognition, which leads to academic jobs, which leads to academic career advancement. So could all of this be playing into the fact and contribute to the reasons that the EU only has 21.7% women in positions of heads of higher academic institutions? So places like universities or departments within universities are being run by women. To make matters worse, in the UK, within these jobs, there is a gender pay gap of 15.1%. The cycle perpetuates itself on and on and on. So whilst research is one side of healthcare, it is not all of it. So I speak about research because it's a different type of leadership that people don't always associate with leadership roles, but they're quite visible and quite often the ones that we relate to earliest on in our careers. But let's speak about leadership itself. Conferences are places to showcase the brightest and best ideas and people. And we at Women Speakers in Healthcare wondered, could this lack of role modelling also be part of the problem that despite the NHS workforce being 77% women, only 17% of women are in NHS leadership positions? Could these events be part of playing a role in telling women that they don't belong in leadership positions or in positions of authority in the NHS? Are these conferences simply reiterating all societal stereotypes that women are not part of the team? We are an afterthought and should be grateful to be in the room. We definitely don't deserve a seat at the table. When women don't have access to the decision-making room, you lose diversity of thought. We know that diversity of thought improves a company's creativity and makes it more successful, and that it leads to better health outcomes. Now, diversity of thought is hard. I'm not going to sit here and tell you that it's easy. If it's easy, we'd have done it already. But it is important, not just for women, but for all forms of diversity. It is important. It matters. It makes us better healthcare professionals, which means it's better for our patients, which is what this is all about after all. During the pandemic, the gender health imbalances became more pronounced throughout the globe. The United Nations stated that the crisis was exacerbating existing gender inequality, and therefore all crises responses must be gender responsive. Unfortunately, so much of the response did not take gender into consideration. One concern, for example, came from the logic that Caroline Criado Perez highlights in her book, Invisible Women, that the protective clothing that is worn is rarely designed for a woman's body and is usually for the average white male, 70 kilograms. So the thought process is, could the PPE that was being issued and worn during the pandemic actually be ill-fitting for women because it's not designed for them, and therefore not as protective as it's meant to be? I don't have any published data to disprove this assumption, but I think were more women of leadership, more women in leadership positions, could this have been pointed out sooner or looked at or researched? Because there would have been that different perspective and there would have been a better understanding in the room. Now, I know what you're thinking. I'm telling you that diversity is good, but where's the evidence? So if you don't believe diversity is good, here's a really, really important fact for you to remember, and a bit of research that I'll share with you. Bloomberg Business looked at hedge funds. Those are people who make lots of money by betting on the stock market. They looked at the boards, which are the people in charge of the company, and they looked at the makeup of these boards. So they compared boards that were fully white male boards versus those who weren't white male boards. Listen to the results. Those who had diversity of any kind outperformed those who didn't by 2 to 1. That's huge. So if you have no diversity on your board, you might make £1 million, because let's be honest, hedge funds make ridiculous amounts of money. But if you have diversity on your board, you're going to make £3 million. That's a lot more money. And that's hard incentive to change your organizational structure, be it hedge funds or the NHS in general. That's pretty damning evidence for diversity. This is not all, though. Forbes magazine, amongst others, other journalistic outlets, have written quite extensively over the pandemic about countries that have been run by women. These include Germany, New Zealand, Iceland, Taiwan, Denmark, and Finland, who all appear to have had better outcomes during the pandemic. I say appear because we're not out of this yet, but they appear to have had much more measured and realistic responses versus their male counterparts who have downplayed the risk of the virus, ignored scientific advice, all to the detriment of their population. Yes, I'm looking at you, America and Brazil. Now, of course, I'm making some sweeping generalizations here. And there are numerous theories as to why this might be. But these female leaders have been able and willing to listen to public health experts and take on board what they've said, put that advice into play, and they've taken decisive action when it was needed. Is this fundamentally due to being a woman? Perhaps. Perhaps it's more about being a great leader and being able to showcase that women simply can be great leaders. Something for so long thought impossible. Women were thought to be weak, indecisive, and simply bound to the kitchen. But why am I here talking to you about this today? What have I been doing to earn a place at this conference amongst such prestigious and esteemed colleagues? As I said, I'm one of the co-founders of Women Speakers in Healthcare. And we think part of the lack of leadership roles for women comes down to a lack of representation at healthcare events. That this is one of the grassroots causes. So what have we done? Since April last year, we have had over 550 women and men allies join our database. These women cover all shapes and sizes. We have physios, academics, doctors, nurses, patients. We're people who self-identify as Black, Asian, Chinese, white, gay, trans, differently abled. We've had over 50 speaker requests, are on about 50% fill rate. We have over 2,800 followers on Twitter. We're on LinkedIn, and we have published articles in the BMJ and the Future Health Journal. We've presented at several conferences along the way and have had a lot of support. And we've launched a sister venture in Australia and New Zealand, because this is not just a UK problem. We've gone international. Now, we're not so naive to think that we will solve all the issues of representation and diversity with some women speakers. But we do think we might start changing the rules. Because here's the truth that we don't talk about. None of this, none of it, none of these systems were built for women or for any kind of diversity. It was built for a lifestyle and a persona who is severely outdated. None of us were meant to be part of this game. The rules were not made for us to play it. And the rules were never fair to us. It is an antiquated type of game, and it's hurting our society. There are so many different versions of working life and family life now that the system must change. We must break the rules. We must change the game. And now to you, my audience. You are the future of healthcare. You must be aware of these issues. We need you to be champions and allies and colleagues. We need you to join the cause and call out these disparities when you see them. We need you to use your new perspectives, your own diversities, all as glorious and unique as you are, and to speak up when we get it wrong, but to champion us when we get it right. You are our future healthcare leaders, you sitting right there. So come and join our team. We're going to make one hell of a racket until we achieve our goal for balanced gender representation at all healthcare conferences and events, with parity of opportunity for all. Thank you very much. Let's see if we've got any questions. So we had one question earlier, DJ, I think that's right, saying, what do you think about the recent med bikini trend? Chadney, I think this is a great question. I think let's take it back to this, the base steps, because as I have said, I've spoken about research in this as well. 6 blokes and a woman got together and had seen a paper previously presented, previously published, that looked at something similar. And I think their intention was to try and educate trainees about social media. And I think there's going to be a talk about social media later, because it's something that hasn't been around for that long, and it's something we all need to be aware about. I think their intentions were good. I think they went about it in the wrong way. And I think there were quite a lot of assumptions made on that, and quite a lot of bad decisions made, for want of a better turn of phrase. Now, the problem that I have with it is we had 6 men on the authorship with 1 woman. So we've got a lack of diversity there. I don't know the ethnic makeup, but it looked like it was majority white. Again, I'm basing that very superficially on the names of people. So again, I could be completely wrong. And we've got to look at where they published. So they published in a vascular journal where both the editors, again, appear to be white men. And I haven't looked at the editorial makeup of the board, but I would assume, being that it's vascular surgery, that it's probably all male as well, or very male dominated. Now, had there been some more diversity there, would this paper have even got to be published? Probably not. Hopefully, if there'd been some more women on there, they'd have read through the methodology and gone, oh, this doesn't sit right. And actually, perhaps if they'd maybe had some more men who are maybe a bit more woke, then perhaps that wouldn't have got to the place that it did do. What I am pleased to see, though, is that I think I've seen at least 2 out of the authors, and I think both have been the first and second, have issued an apology and have very much taken on board and reflected on what's been pointed out to them as some poor methodology and some poor judgment. It sounds like they've reflected, they've learnt, and actually they have voluntarily said that they want their publication retracted. And the journal, to its credit, has taken that on board and has retracted the paper as well. So I think as with much in medicine, we make mistakes, we are human, but part of making mistake is A, having that duty of candor to hold your hand up and go, do you know what, guys? Do you know what, folks? I made a mistake. I got that wrong. Mea culpa. This is how I'm going to learn, and this is how I'm going to change. This is how I'm going to be better. I think the Med Bikini thing in general is just hilarious, and well done, Med Twitter, for taking something that's not great and making it into something a lot funnier and getting national coverage for it. So I think the Med Bikini, to me, really just shows a lack of diversity on these research and editorial boards. Right, we've got one here. As a male, so this is from Arshad Dalhan. Sorry if I pronounced that incorrectly. As a male medical student, is there any advice you could give me on how I can go about being the best feminist I can possibly be within the healthcare system? Excellent question, and welcome to the male allyship. I mean, the fact that you're coming to this talk is a great start, because there is, and this isn't my field, but I think it's something we're all aware of. I've been reading a lot about allyship for the Black Lives Matter, and something that's come up as a white person is to not be saying I don't see race, because A, that's insulting, and B, race is part of our culture, and if we're going to get better, we need to be able to understand that we are all different, we've all got different perspectives. So I think the first thing that you can do is sort of by not saying I don't see gender, because women do have different issues from men. We're not at the place yet where society is completely equal, and until we're at that place, we need men like you to help fight for us, to maybe see that that colleague isn't putting themselves forward for something. I'm a general surgical trainee, and I say to my male juniors that men are still more likely to put themselves forward for theatre time. If you are, as a medical student, with a woman that you know wants to do surgery, just be aware of that. Make sure that you're trying to share the time between you. Be aware of the fact that they may not feel as comfortable to put themselves forward for things. Let's say you get offered to do some research, or you can make sure that on your authorship board that you've got an equality of men and women. And if you don't, say to the lead author, oh, actually, do you think we should get more women involved? As a student, you'll know lots of other women that might want to be interested in that subject. Ask them to come and help you out. It's really about, and I love this expression, it's about lifting as you climb. So it's about holding out your hand to somebody and saying, come with me. I want to take you on this journey. I've got some power and some privilege here, which I can share with you, which means we're just going to be better as a whole overall. So Beth, I will have to read that piece. What advice would you have for medical students who've experienced sexual harassment or discrimination whilst on placement? Good question, tough one. Firstly, I would say make sure that you've spoken to somebody about it. We know that sexual harassment and discrimination on placements is not unheard of. Fortunately, I say fortunately, it shouldn't be happening at all. I think it depends on where the placement is and where you are. I think as a student, it can be really difficult to speak up about these things because you're there as a transient. You might only be there for 4 weeks. I would make sure you can find somebody who you consider an ally, either somebody who might look like you, or maybe, like you know, a male ally that you've become friends with, and talk to them about what's happened. And I don't say, depending on the seriousness of it, to belittle anything, but no discrimination or sexual harassment is acceptable. But question is, do we need to be getting the police involved? Do we need to be talking to HR about the behaviour of this person? I think the other thing to do is make sure that you're speaking to your university and your personal tutor at university, or whoever's in charge of that placement. Now, the difficulty is if it's the person that's in charge of the placement, who do you speak to? There are other juniors, there are registrars who will be allies to you, and you can always come back to university. Universities have dealt with this unfortunately, regularly enough that they should have really good ways of helping involved. And the other thing is, if you're really stuck and you feel like there's nobody that you can talk to, you can always go to your GP, because that's a confidential place. And it might be that this happened a while ago and actually you're seeking some mental health support, like maybe some counselling, or maybe you've suffered some PTSD with it. So there isn't, unfortunately, a one size fits all for that question, but I hope that helps a bit. Now, I think on the flip side, this is where we as allies to each other have to help out. If anything happening which we think is discrimination or sexual harassment, I feel we have a duty to stand up and say, hang on, that's not right. It's not always easy to do, but there is so much power in using some of your privilege, particularly me as a white woman, who is now a senior amongst the medical community. I know that I have a power and a privilege and a responsibility to make sure that there is pastoral care for students. And I think that's something that we're all starting to realise and get better at.
Hi, Greta. Sorry.
I was going to say there's 2 minutes. There's one. Can medical students join WSIH? Yes, you can. Please go to www.womenspeakersinhealthcare.co.uk. Please sign up and join our database. We're always looking for future leaders and speakers. And also that way you'll be on our mailing list, because we're starting to look for different ambassadors and medical students to help out with different bits of research.
Hi, Greta. I think we might have to stop the session if that's okay.
Yeah, I was going to say, it's 2 minutes to 12, isn't it?
Yeah, I'm so sorry for having technical issues earlier on and then disappearing on you.
That's all right.
But thank you very much for sharing your experiences with us. Thank you very much for speaking about your experiences, also about research, about the diverse roles that we as a diverse group can play within medicine, the roles that we can play as allies, and also pointing us in terms of resources and groups like WSIH that we can join in the future. I wanted to ask, would you want to stick around for the next session? I'm just wondering, would you have somewhere to go?
I would love to, because I know it's the one about social media, isn't it? But like I say, unfortunately, today I've managed to squeeze this in, but I don't think my wife would be happy if I stay in the bathroom talking to people online.
Oh, okay, no worries. But thank you very much for joining us.
Unfortunately, that might get me in the doghouse.
Yeah, I can see so many thank yous coming in on the chat, and thank you everyone also for posting your questions. And I'm sure, Greta, would you mind if they give you a follow or on Twitter? And
no, absolutely, please. I'll pop my handle in on the chat again. Please do follow me on Twitter. I'm fairly active, and if you DM me or want to get more involved in Women Speakers, please do just feel free to message me on there. Follow us at Women Speakers HC, which I'll also put in the chat as well, which I've just done. Please do follow us there as well. Get involved, speak up. We need to look after each other, everyone. We need to be kind to each other. I think that's the most important thing. But please do feel free to. I have my DMs open, so follow me, and if there's anything I can help you with, I will do my best.
Okay. Thank you very much, Greta. Have a fantastic weekend.